nutritional risk factors. In other words, unhealthy diet is one of the biggest risk factors for chronic disease that we can control.
She was with Health Canada, started out as a research scientist, became director of the Bureau of Nutritional Sciences in the Food Directorate. She also set up a collaborating center with WHO at our department at the University of Toronto.
So Mary was at Health Canada and brought several food labeling regulations into effect in Canada. With regards to specific nutrients of concern, at one point in time, Canada had the highest levels of trans fat in the world in our diets, and Mary created and implemented a program in order to bring trans fat levels down.
Mary has been able to capture the food labels of the foods in the grocery store, for a good percentage of the foods in the grocery store. So initially she had an army of graduate students, undergraduate students do that, and now they do it more by mining the data that's on the web.
While I was at PAHO, I was collaborating with her lab at the University of Toronto, and she developed this app to collect packaged food supply data.
I mentioned our big FLIP, or food label information and price database. Well, now we support researchers in 18 countries around the world who are now collecting data about their food supply, and it's their country and their country's data. But we've developed the infrastructure, the architecture, we train them how to do it. We've set up all that work, and we were really fortunate. A lot of that work was set up by supporting our research in Canada.
Mary's mentorship is very helpful. I know that she's done this for other trainees as well, to strategize ways in which we can navigate our careers in order to achieve as much success as possible.
Her willingness of being available to collaborate and support efforts not just in Canada, but in other countries as well, which speaks about her huge energy and passion for public health.
She's really trained a whole new field of people in Canada in terms of nutrition policy. They're leaders in their own right and becoming leaders in their own right across Canada and elsewhere. So I think mentorship, in my mind, will be a big legacy of Mary's.
Mary is fearless. She's brave. When she believes in something, she just goes for it. And so in my personal career, and I think other scientists, especially women scientists, can take that attitude of, I'm just gonna go for it. It's something that I believe is important. The data is showing me it's important. And just going ahead with all the certainty that you have in your heart. And that's something that I think it's part of my success today. She is really an amazing individual who is active and just lives life to the fullest. And I'm so happy to know her.
Innovative nutrition scientist whose research and policy leadership have created healthier food environments and transformed chronic disease prevention in Canada and around the world. Canadian Medical Hall of Fame laureate, Dr. Mary Labe.